Hello, Ms. Shedd. My name is Dr. Gianni. I'm the radiologist who's reading your MRI of the knee. I'm going to walk you through the findings of my report, and as I do that, I'm going to scroll through the images so that you can get a visual with what I'm describing. So the first thing I noticed on your exam is that your anterior cruciate ligament, right here, exhibits increased signal and thinning. So thinning and edema within the ACL is consistent with severe sprain and partial tearing. Similar findings are appreciated within the origin of the medial collateral ligament. That's this black line that we see here. There is also increased signal and, there's also severe sprain and partial tearing of this ligament origin as well. Next, I noticed that there was a minimal amount of strain within the proximal fibers of the extensor digitorum longus and peroneus longus muscles. This represents a component of muscle strain. Next, there is a mild bone contusion at the posterior aspect of your lateral femoral condyle. If these injuries were a result of trauma, this is likely where you were struck. This is consistent with a bone contusion. Next, there's osteoarthritis of your knee. It's characterized by marginal spurring at the edges of the joint. So these little spurs represent marginal spurring. That lets me know that osteoarthritis is present, and then we grade osteoarthritis based on how thin the cartilage has become. So you have moderate to severe thinning of the medial portion of your patellofemoral compartment. This is the articular compartment underneath your kneecap. This is stable compared to your prior exam. It also has some mild edema and fibrocystic change. And then although there is marginal spurring at the lateral and medial compartments of the joint, there's no significant cartilage thinning here. So this is only considered mild osteoarthritis. Lastly, I noticed that there is a knee effusion. So an effusion is a buildup of excess fluid inside the knee joint. This fluid builds up as a natural response of your knee to associated injuries, as long as they're inside the joint. So because we have the ACL injury and also the osteoarthritis, it's no surprise that there would be a mild amount of excess fluid within the joint. You experience an effusion as a swelling sensation within the knee. So that brings me to the end of the exam. The rest of the structures of the knee are intact. Again, my name is Dr. Gianni. Thank you for choosing First Look MRI. Please consider us in the future if you require any follow-up imaging. And I recommend discussing these findings with your doctor. A good place to start would be with a primary care doctor. And after listening to your symptoms and you're performing a physical exam, they can determine whether you require a referral to a specialist. During your clinic visit, they will want to evaluate the stability of your ACL. So the ACL is one of the principal stabilizing ligaments in the knee, and if it's severely sprained and partially torn, it may not be the ligament may not be competent to do its job properly. If the knee is unstable on physical exam by your doctor, they may refer you to a specialist in order to optimize treatment of the ligament. So again, my name is Dr. Gianni. Have a good afternoon. Bye-bye.